All right, guys, I'm going to go ahead and start now. Thank you for attending our webinar on platelet-rich plasma. I'd like to introduce our presenter, Dr. Santucci. For those of you who don't know, Dr. Santucci is the Clinical Director of Advanced Region Medical Incorporated in Neurointegrative Care of Los Gatos. He received his BSBA from Georgetown University. He studied functional medicine with the originators of the field, including Jeff Bland and Mark Hyman. He completed the Achieving Clinical Excellence series with the Functional Medicine Institute and fellow in functional medicine with AAIM. Dr. Santucci expanded to learning systems, studying over 1,000 hours of functional neurology training with concentrations in functional neurology with the Carrick Institute, as well as rehab of vestibular systems and childhood development delays. He has taught advanced diagnostics and clinical interventions to medical doctors and their staff. He's taught at the American Functional Neurology Institute, Health Centers of the Future Platinum Conference, and the Applied Functional Medicine Institute's Technology Conference. He's currently rewriting his first book, reporting 20 years of functional medicine, called Constructing Medical Miracles, Return to Health Using Today's Technology. So keep an eye out on that. Without further ado, I'll hand it over to our presenter, Dr. Thomas Santucci.
Great, thank you for that. Today we're going to go a little bit into the different options in functional medicine, regenerative medicine. So we had looked at this whole subject 3 years ago when we first started, and there was a big kind of division. You know, do you do autologous stem cells, which means comes from your own body, or do you do stem cells that come from the birth process? And there was a huge divide in those days. A lot of conversation about, you know, what's safe, what's judicious, what do we have research on? Well, it's 3 years later, and we have a lot more information and we have a lot more research. So let's go ahead and dig into that. I'm going to get rid of that, and I'm going to try to find the next slide thing, which I can't find. James, give me a hand here.
Sure.
Oh, we have a microphone right in front of this indicator, so you'd think I'd know where that is, but I don't. Anyway, so today we're going to be talking about PRP, platelet-rich plasma. And it used to be platelet-poor plasma, and which is this stuff, which is the part that is a little bit yellow. But platelet-rich plasma is a very, very special layer of centrifuge red blood that can act as an autoimmune modulatory and anti-inflammatory and has tons and tons of growth factors. So we're talking about what are the benefits of this kind of therapy, how it's derived, and when it's appropriate to use. This, like everything else, is a tool. And it gets to be very interesting. I kind of don't envy anybody that's trying to do research on anything in regenerative medicine on the internet, because what you're going to find, I'll show you a couple slides, but what you're going to find is the people that are exposing any one therapy are giving you kind of half the story. And if they don't do another therapy, they don't either list it or they just say that it's not any good. So you can get to see some of that for yourself in this presentation. So we made a little movie, a doodly movie, and I like these because it reminds me of those first movies I used to see as a child that explained very complex scientific things with cartoons. And so, what we did is we kind of are going into some of these details of, what's the autoimmune modulatory effect of stem cells? How is, what's their reaction to a COVID-19 virus? And at this point, literally what are the details of how PRP moves? So let's take a look at this clip and we'll pick it up after that.
Relieving joint pain and arthritis with our own blood? Modern medical science now gives us the ability to isolate arthritis with our own blood, to decrease inflammation and lubricate damaged tissue, accelerating healing and reducing pain within the target area. Over 20 million Americans suffer from arthritis and joint pain that prevents them from doing the things they love, such as playing with their children or grandchildren, comfortably traveling long distances with their loved ones, or even basic chores around the house. These problems can cause many to feel incomplete and even cause personal problems with those they love most. Before now, the only options were to mask the pain with drugs or undergo the long and risky process of surgery. Now there's a better, unique, and effective solution that is like nothing else before. What is platelet-rich plasma? Platelet-rich plasma, or PRP, is blood plasma with concentrated platelets. The concentrated platelets found in PRP contain growth factors that are vital to begin and promote tissue repair and regeneration. These growth factors include epithelial growth factor, fibroblast growth factors, insulin-like growth factors, platelet-derived growth factors, vascular endothelial growth factors, transforming growth factors, cytokines, and hepatocyte growth factors. These bioactive growth factors will reinitiate connective tissue healing by recreating extracellular matrix, bone, and possibly joint surface regeneration and repair, promote development of new blood vessels, and stimulate the wound healing process, which improves immune response by polarizing macrophages. PRP therapy harnesses the power of the patient's own body to heal itself. The procedure is autologous, meaning it comes from the patient, is non-invasive, and requires little to no downtime, and it involves little to no risk of infection or complication. So how does PRP therapy work? First, a small amount of blood is taken from the patient's arm. The blood is then placed in a specialized centrifuge. The centrifuge spins at high speeds and produces the PRP. The entire preparation process takes less than 20 minutes and increases the concentration of platelet and growth factors up to 500%. The PRP is then injected into the damaged or injured area. This stimulates the tendon and/or ligaments, which causes a mild inflammation that prompts the growth factors to work and triggers the healing cascade. This results in development of new tissues and causes strengthening of tendons and ligaments of the damaged area. This new process took many years to develop and was mostly only available to wealthy athletes. But now it is available here in the USA at reasonably lower cost than before. Our process is quick and easy with patients getting treatment and going home the same day. There's no having to worry about rejection or safety because we are using our own blood. So don't wait any longer. Visit our website to learn more about PRP therapy and how the body can heal itself faster and more effectively than before.
Great. So I like these doodly movies because they can explain very complex things, but let's slow it down a little bit and sort of take that apart. So the process of obtaining PRP draws your own blood. And there's different methods to do this. So we're taking about 60 milliliters. It's a big tube of blood that we're taking out. We're spinning it in a very specialized centrifuge. Centrifuges can cost $300. Ours costs $5,000. So a centrifuge that isn't going to denature the proteins is crucial here. So the centrifuge basically uses a special separating tube, and the tube is going to have the red blood cells at the bottom, the platelet-poor plasma, it's sort of a white liquid, and then the very, very specialized platelet-rich plasma that's here, and that's the level that we're going to talk about. So 60 milliliters of blood, which is a big tube, creates 6 milliliters of PRP. When you start thinking in terms of regenerative medicine, you start thinking in terms of stem cells, you know, a couple of cc's of stem cells is $7,000 or $8,000. So when we're looking at 6 cc's of PRP, it's a couple $1,000. So one of the big advantages of PRP is that it uses your own molecules, your own blood, but it's a lot less expensive for a lot more product. And we're going to go into what it can actually do. So the characteristics of PRP is that it has basically very, very, very low risk of anything going wrong from an allographic procedure. Now, this isn't the biggest claim in the world because stem cells after 110,000 transplants have had no risk of allographic contamination. There's never been a host versus graft problem. But I think for people that are worried about that, and at some level of the population is, that PRP becomes a better option for them. It has a lot of growth factors in it. So if we looked at the movie, there was 6 or 7 that they listed, there's actually hundreds. And so what happens when you put growth factor in a wound, you can accelerate healing. One of the distinguishing characteristics of plasma-rich protein is that it has something called extracellular matrix. So it forms like a gel which can cause adhesions. So I had a sprained ankle for the first time in my life after I did stem cells. So I actually rolled my ankle, so I had a sprained ankle. And it really wasn't a job that we needed to use stem cells for. So we extracted some blood, we spun it down, we put it in my ankle, and it did the job. Now, it didn't do it with the kind of the vivaciousness that a stem cell would. Stem cells have this way of kind of making you feel very, very, very capable. The pain subsided over like a couple of weeks, and I sort of view my right ankle as being normal. I was having trouble with my left knee. We put the PRP in that, and it took about 12 weeks. Stem cells would have worked 3 times faster than that and probably would have done more for, like an overt disruption. So it's not that nothing is going on, it's just a slower process. PRP contains immune cells, white blood cells, to upregulate immunity. Again, if we're doing a comparison 1-to-1, it's probably about 1/3 as much as stem cells. So when we're looking at PRP applications, we're looking at orthopedics. So we're definitely always going to start there because that's, kind of the world we live in. So, and I'm going to go into those details. But stem cells are being used for, the vampire facelifts, for hair loss, lots of microdermabrasion stuff or microneedling where you're, doing little pinpricks past 5 layers of dermis and then it heals in a very particular way. If you added either stem cells or in this case PRP to that process, it would work significantly better than if you, added collagen or didn't add anything at all. So this is a big world. Cosmetics and aesthetics is a blossoming world. And again, there's some appeal to this. These microdermabrasion rollers can take acne scars away. They can certainly reverse aging wrinkles and, fine lines and that kind of stuff. And then the same processes can be done on the scalp. Those are specialized clinics. I doubt we're going to be able to get into that because of my preference. But this is definitely something that is effective and safe and is being used well. The dentists are, especially the new dentists, are kind of the good innovators in that world. And, they picked right up on stem cells. They're picking right up on PRP. Anytime you have a wound that's healing and you use either these stem cells or these growth factor derivatives like PRP, you're going to have a better outcome. Eyes are probably the big frontier, one of the big frontiers. Neurology and optics are the 2 things that I think we're going to see in the next 5 years. The international studies on restoring, blindness with macular degeneration using stem cell injections and PRP injections are about 95% favorable with no downside. So this is something that's going to happen. The United States has just been really slow on the thing. A blossoming world, both with PRP and with stem cells, is diabetic foot ulcers. So we're looking at, basically wound healing. So if you do a patch made out of stem cell or an injection made out of PRP, it can greatly accelerate the damage done by, the devascularization and the glucose handling stress caused by diabetes and diabetic neuropathy. Again, these are going to work better if you're doing the underlying cause and fixing the glycemic index and, looking at, the reasons for the blood sugar disruptions. But this as an intervention is, this has an 80 or 90% success rate when done in concert with the lifestyle changes. So a lot of people will remember this chart. We put this together about 3 years ago based on this meta study. And in those days, there was a big question. Do you use your own stem cells or do you use stem cells that come from the birth process? And there was a big difference. And one of them was that the ones from the birth process had no adverse medical events, meaning nobody was hospitalized, nobody died, whatever. The ones that came from fat and bone marrow had 2% adverse medical events. But I think if you compare this with normal surgeries, which I would guesstimate to be at 5 to 8 to 10, depending on who you talk to, adverse medical events, it's still way, way, way safer stuff. What's happening, the basic rules on stem cells is that you can't use stem cells for a non-like use. So it means you can't manipulate the stem cells. And one of the things that's true about fat cells is that there's some manipulation that goes on, and it's questionable whether the FDA is going to actually allow the use of our own fat cells. Bone marrow, we kind of ruled out because it takes 2 surgical procedures and that are pretty invasive, and it has the least number of stem cells. So we sort of ruled that out. And then PRP was kind of lumped in with these autologous, meaning from your own blood or from your own body, regenerative solutions. Remember, PRP isn't stem cells. It's blood that is platelets. And platelets have different characteristics from stem cells, so we sort of passed them over. They didn't really have the regenerative capability that we were looking at. 3 years later, we're looking at it and saying, they probably have a lot less debris and reactive oxygen species if you're spinning them down and you're doing it in real time. The harvesting method of a blood draw has been perfected, and now there's specialized equipment that's used. So that we think that the adverse medical events, while they still are being listed by the FDA as 1%, which is still very, very few, we think that number in the new procedures is approaching the umbilical cord blood, perfect record. Immune enhancing, we think that there's some research that's going on that says that that's being improved. Anti-inflammatory effects, and certainly, the growth factor part of stem cells may be a couple of points higher than what we saw before. So one of the things about, the reason they call it practice is you get smarter, and, so something that we wouldn't have really considered 3 years ago, we're now considering for a couple of good reasons. So if I put stem cells and PRP on a chart against each other, then remember, stem cells have 4 basic characteristics. They make copies of themselves and copies of damaged tissue. They're autoimmune modulatory. They are anti-carcinogenic, and they actually have a positive effect on DNA telomere tails. So this is basically, the autoimmune activity. This is the growth that's happening. This is the cancer fighting. This is, brain-derived neurotrophic factor. So, and this is essentially recreation of different kinds of cells, including blood cells. Well, when you look at PRP, and we're just really here talking about growth factors, PRP is, so they're platelets. So we're going to end up with probably 5 times the normal platelet count. And so ultimately, this is growth factors, different kinds of things going through different cascades, and we're going to end up with more mesenchymal stem cells. So this cascade goes right over to here and starts this cascade. So while these umbilical cord, while these plasma-rich protein derivatives don't have any stem cells in them, they cause your body to create stem cells. And in this case, more is more. So one of the things that we did when we were picking a centrifuge is we got one that could handle 60 milliliters of blood, which is, again, a chunk. It's about as big as this microphone. So not an incidental amount of blood. Still, putting things in context, I made this chart to kind of say, pros and cons. And again, what you're going to see in the market is very polarized kind of positions. I read one article by the orthopedic surgeons that basically was saying they're doing 5 times more PRP than stem cells, so it must be 5 times as useful and good. It's not. It's 5 times as convenient, and it's 1/5 the cost, or 1/3 the cost. So there's definitely, financial reasons and convenience reasons to do PRP. If we do a stem cell injection, we have to do an exam, schedule it in ahead, order the stem cells from the Utah Cord Bank, basically do that protocol, write a report on them, and administer the procedure in 2 follow-up visits. If we're doing a PRP injection, we can decide that day, spin it down in our centrifuge, use one of the specialized collection kits, and apply it the same day. There's a huge convenience factor. Again, stem cells are $6,000 or $7,000. This is $2,200. Another benefit of PRP is that they contain extracellular matrix. So remember, the tertiary structure of these ligament complexes, the glucoarabinogalactans, are woven in a particular way. And the cellular matrix, there's some in stem cells, but there's at least as much in PRP, which is a huge thing. There's a big anti-inflammatory effect. Again, stem cells are going to, be the heavyweight here. They're going to win this. They're more expensive, and they're more rare, really, and they're more they're not modified, but there's a lot more care and feeding done in collecting and providing stem cells. But growth factors are definitely there in both things. Remember that chart where we saw 6 different kinds of growth factors, and then immune bolsters are definitely there. If I looked at regenerative capability, and this I'm going to use my own experience. So I have done stem cells. I've done 4 different kinds of stem cells, and I've done PRP. The PRP wasn't bad, but the stem cells can be miraculous. So my personal opinion is that stem cells are a lot more powerful than PRP. But PRP compared to steroids or compared to amniotic fluid is a clear winner because of the lack of the adverse medical events and because really this extracellular matrix and the convenience. So this is kind of like a movie rating. There's definitely a lot of subjectives in it, and we definitely get the people that are saying, that they have these preferences. But I think, if we say that stem cells are a 10, then PRP is like a 3, 4, some number like that. So I think they're 30 to 40% as good as stem cells under the right circumstances. I think amniotic is in that same kind of category. The filtered amniotic products are less, so the amniotic products without the stem cells, I think are probably over here somewhere. And again, that's just my opinion, but again, it's hard to find practitioners or researchers that have personally done these things. And so, like if I got stem cells, I would think I would have to use 3 times as much PRP to do the same thing as the stem cells. So when would you use PRP? So again, we're a stem cell clinic. What are we doing talking about stem cells? Well, after a stem cell treatment, a touch-up. So there's always an area that requires extra, care and feeding. The other thing, like me, so I had an ankle sprain. PRP is excellent for joint injections and intermuscular injections. And it's like a less formalized, easier thing to do. And then there is a certain population, for whatever reason, doesn't want any cells from anything anywhere other than their body. This isn't a terrible idea. So, basically, if we have concerns for, or a preference for autologous procedures, this is one. And then for sure, there's financial considerations. Most people can, handle the finance of this a lot easier than they can handle the stem cells. So in our clinic, this is what we're beginning to do. There's a lot of, top-offs of the people that have already had stem cells. And so one of the things we're going to do is make this convenient, easy, and inexpensive for people who have already had stem cells. We're going to actually give them PRP for half price for February. And in general, when we're introducing a new technology, we want to get about 100 people that have done this, and then we kind of get our own clinical rules for the thing. But we're going to take 60 cc's, 60 milliliters of blood, spin it down to 6 cc's of PRP. And, at that point, you can go intermuscular, so like paraspinals, that kind of thing, or ankles or knees or elbows or wherever. And 6 milliliters from a regenerative point of view is a lot. Again, the target tissues are almost the same as stem cells. Knees are predominant, hips are in there, shoulders are in there, and then there's like a distribution of wrists and other things. But this is really excellent for rebuilding that tertiary structure of the ligaments, those glucoarabinogalactan complexes, because of the growth factor and the anti-inflammatories. So the bottom line is that PRP's lower cost makes it accessible to a wider audience, great adhesion because of that intercellular matrix and growth factor characteristics. So we can repair ligaments with this stuff. And again, way better than collagen complexes, way better than steroids, way better than prolotherapy, saltwater. And then clinically, we're looking at the stem cell people, just like me. I had 6 milliliters of stem cells. Then I did PRP, and it cleaned up, an ankle sprain that I had. So there's always an area that requires a little extra care, or it can be used as a booster shot. In people that have stem cells in them, especially some of the people that have done a good job keeping up on those, then a booster shot made of their own PRP is going to be pretty virulent, so it's going to work pretty well. Like my own worked pretty well. I was pretty happy with that. So when we look at this whole thing, we're adding PRP to our product line. We're not thinking so much about amniotic fluid anymore, especially the filtered amniotic fluid. We just don't think that brings as much to the table as either stem cells does or this does. And then we're looking at the ancillary rehab protocols like Synexus that can fix the peripheral neuropathy nerves, or pulse electromagnetics, or even the neuromodulatory exercises like Spine Force as being kind of our product mix at this point. So as we introduce this, we always have one special offer a month. And so I'm going to click it into James, and he's going to talk to you about that. At any case, advancedregen.com is our basic website. That'll give you the information, really what we're doing in the clinic, and it'll always have in this case, the February offer. Facebook is getting more and more pronounced, and I hear we're doing stuff on Instagram, so I guess we're joining the 21st century. That'll always have the animations, the doodlies, which is a good way to learn about these things, and then the reprints of these websites. So appreciate you taking the time. Look forward to seeing you next, probably 2 weeks.